Hello, I'm Mayor Skip Hall. Welcome to this special report on issues related to COVID-19. This is a challenging time for our city and our country and the world. While the situation surrounding COVID-19 continues to evolve, we as a city are working hard to preserve public health, our local economy, and to maintain essential services. The city has a team gathered together to ensure that our response is quick and effective. Leading that team, our city's emergency manager, Tracy Montgomery, and our assistant city manager, Mark Schott. They're here today to update us on the city's response. Then later, I'll talk to our Human Service and Community Vitality Director, Seth Dyson, about the ways we're caring for our vulnerable populations during this time and how we can get involved. Tracy and Mark, welcome. Welcome to the show.
Thanks for having us.
Tracy, I know with this kind of an emergency, we have to organize differently. Can you tell us how we're organized and what we're working on?
Absolutely, yes. This does require some different configuration. We've stood up our Emergency Operations Center, so that's our, normally that's a place where we all go to manage the incident, and we'll talk a little bit about how we made some modifications there. We've also stood up an incident management team. So in normal business operations, daily operations, we have the capacity to handle most incidents, but this is a big one. And so we've reconfigured some of our organization to handle these real-time issues about communication, about information coming in, about resources for the community. So we're organized a little bit differently to be a little more efficient in our response. And frankly, it's going very, very well. I think we're really doing a great job with internal and external communication and managing all of these issues.
Good, good. Well, with the social distancing piece of this, it's got to be challenging putting the team together and complying with that.
Absolutely. You know, when we think about putting an incident management team together, we never really thought about, but what if we can't physically meet with one another? So we've leveraged various meeting applications, phone meeting, virtual meeting applications. We have an app that we've pushed out, Evertel app, that helps us communicate in real time in our incident management configuration. And so we really are able to lead by example with social distancing and not have physical meetings that, you know, amount to a gathering of over 10 people. And you can imagine we don't want anyone to get sick, but certainly someone amongst our incident management team getting sick would be a more of a disruption. So we're really happy that we've come up with these workaround solutions.
Mark.
Mayor.
It's good to have you here.
Thank you, sir.
You know, as Tracy has mentioned, it causes our city to do business differently. Can you talk to us about how we're doing things differently in the city?
Certainly. Well, like we're really seeing across the state and across the nation, we've taken some precautionary measures. That's included closing City Hall. We've closed some other city business locations, and that's caused us to do business differently. So it's allowing us to streamline some of our essential services. We're making those available by telephone, by email, and in some cases maybe even by appointment only. But it's important to keep those essential services up and running. And the incident management process that Tracy just mentioned, we have an arm of that that is just focused on our community and business outreach. So it's really important to keep our residents and our business community connected with that kind of information for essential functions.
So is there information, really good information on our website, Mark, where people can go to get the latest information?
Our website at surpriseaz.gov, there is a prominent COVID-19 link right on the front page.
Good.
And it'll take you to essential information. It'll take you to great resources. It'll show you interruptions to city services, and it'll give you the connectivity you need for those essential services.
And if someone has questions about what events or services have been discontinued or dislocated, et cetera, that's all on the website? Or
That too is on our webpage. There's a calendar that'll easily really identify the city events that have been canceled and impacted by this.
Okay. And Tracy, what should our community be doing at this time to support each other and you? and your
Well,
team?
you know, community supporting community is a really big part of this. We ask everybody, reach out to your neighbors. We all know those people that maybe live alone or maybe are part of the vulnerable population,
Right.
65 and older, or maybe with an underlying health condition. We need to watch out for one another. But certainly, you know, this assistance starts at home. We've heard ad nauseum about hand washing and social distancing, and you know, the other piece of that is remaining calm. We're still struggling with grocery stores to get the shelves stocked every night and those sorts of things. It is not necessary to buy out all the toilet paper and all those other commodities, because everybody needs to leverage those. And the last thing I'll say is, you know, I've heard some people in conversation say, well, I'm feeling fine, so it's okay to be around me. And I think it's maybe lost on some people. You could be feeling fine and still be a carrier of the illness. And so that's not a great fallback or an assumption to think, well, you know, this group or my family feels fine, so we're okay. The real secret to flattening the curve, as they say, is to try not to engage in a lot of social gatherings or what we call population dense activities. It really is a good idea to keep some distance like we are, and to avoid as much as we can those interactions that may expose us to somebody that isn't symptomatic and we're unaware is carrying the illness.
Right. The grocery store seems to be improving
Yes.
their replenishment.
Yes.
Is that
Yes.
perception right?
We've got some locations where the National Guard has been deployed to help just with stocking. And it's not as a matter of keeping the peace, but
Right.
helping them stock. A lot of places that are 24-hour have switched to closing maybe at 10 or 11 o'clock at night, reopening at 6 in the morning so the stocking can be done
Right.
uninterrupted at night.
Right.
And then most importantly for a lot of our residents, and surprise, some grocery stores are having what they call senior shopping hours. So people 65 and older who show an ID,
Good.
they're the only ones admitted. It's usually in the morning to buy commodities, grocery
Good.
shop, without, you know, the hustle and bustle of a lot of other people
Do
coming
we have that
in.
on our website too, Tracy?
Yeah, that's the one
updated?
that I know that we
Okay.
were planning on putting. We got the information, but we wanted to confirm
Right.
its accuracy before we put it on.
Sure.
You know, this really does come back to taking care of your neighbor, and this scarcity that we're creating ourselves at the grocery stores. We're not hearing that the supply chain has been interrupted. What we're really hearing that is, as soon as supplies that are plentiful enough for everyone are placed on the shelves.
Just demand's elevated. right?
Yes, yeah, there's demands for things that I never would have thought were associated with the illness, but that people are thinking, well, you know, if I had to be socially isolated at my home for X amount of time, maybe I'll need this.
Right,
So,
right.
but yeah, we're having, as you know, through you, Mayor, and through our economic development folks, we're having great conversations with our retailers, and we're trying to assess any issues that they're seeing coming that would maybe prevent or impede their ability to serve the community. And so far, we're hearing they're not worried about supply chain. They're just worried about the best method to get things out and limit how many of these products each family can buy, so
Right.
that there's enough for everybody. And I
Right.
think that scarcity is causing some anxiety, and we're causing that ourselves. So,
Yep.
you know, again, I encourage everybody, if you've got 100 rolls of toilet paper, you're probably pretty good. So, but yeah, that's some of the stuff that we're seeing.
Yeah. Thank you both for joining me today. I know you're working diligently to keep our community safe and healthy. Thank you for all that you're doing. We'll be right back. With some of the economic and service impacts that we're seeing as a result of the coronavirus, it's important that we are focused on social services and supporting our residents in need. Seth Dyson from our city's Human Service and Community Vitality Department is here to talk about that. Welcome, Seth.
Thank you, Mayor.
You know, when hard times hit, it brings out the best in a lot of people. And so how can people want to help? They're calling me or emailing me, how can we help? How can they help, Seth?
Well, it's a great question, and you're right. Now is the time where we see some of the best of humanity who just think about others. They want to serve their neighbor.
Right.
And I think we have a community that really does care for their neighbor, for
Yep.
the community in general. We want to keep everyone safe, but there are ways for people to give back. And so I've listed a couple here, but the first couple areas we're seeing a need for help are food banks. Our food banks
Oh,
have been hit
yes,
fairly hard as well.
yes,
So
yes.
if you've seen the supermarkets have some empty shelves there, the food banks are not alone. So talk to a St. Mary's food bank contact, and they're seeing 2.5 times the normal amount of people coming in. And so they
Wow.
need donations, they need
Sure.
volunteers. They're down 70% volunteers because of the folks needing to stay at home. Many of their volunteers
Yeah.
are a little bit older. And so what they could really use is probably donations. So cash to help buy their sources for food, to
Okay.
help fill the food banks. But they will take volunteers in a safe manner. So they practice their own social distancing. So both, we're lucky and blessed for our community to have 2 food banks
Yes.
in our local area.
Right.
St. Mary's Food Bank and Valley View Food Bank, both are open to receiving volunteers, but everyone needs to call first. So they don't want a bunch of
Okay.
people just showing up,
Just showing up, yeah.
and volunteering.
Sure.
So cash first, if people can do that. Donations also for food, and then also call for volunteers.
Okay.
There's a couple other programs that are looking for volunteers in this particular time, and that's one program is Benevia Home Services, where someone can offer individual volunteerism through Benevia to help with groceries, errands, transportation.
Okay.
Again, practicing very safe social distancing and all of the CDC recommended factors.
Good.
Benevia has a tremendous program already running. What we want to do is just bring exposure to it to help those homebound seniors, especially maybe with those services.
Excellent.
So
That was going to be my next question about meal access for people that are self-quarantined or staying at home, and
yes, we have several options in Surprise. We're really fortunate. So first is at our senior center, we're doing a meal pickup delivery program and a home delivered meal program that we've had to pivot, right? So we've had to shut our center.
Right.
We want to keep people safe. However, if people need food, they call us at our front desk at the Surprise Senior Center. We can schedule them for pickup or delivery. Anyone that's 60 or over can use that service for our resource center.
Great.
The Salvation Army here in town is doing daily breakfasts and sack lunches. They're handing it out between 7 and 9 o'clock every morning to any senior or anyone who's food insecure. And
Great.
again, no questions asked. It's a drive-through process, real simple. But for those who can't leave home and who can't go and pick up the food,
Right.
Benevia, the home services program, will be able to help offer through their volunteer program meals and groceries. But surprise, we're fortunate to work with a nonprofit called Meals of Joy. And so right now, any person who is homebound who wants to have a fresh meal delivered to their doorstep between $10 and $12 a meal, they can call this nonprofit 48 hours in advance and get signed up for their services. And we love that program so much. Our department, with the city's support, has entered into a contract with them to help some of our most vulnerable in Surprise. So as of today, we're going to start taking applications for anyone who's 62 and over,
Okay.
or 55 and over with a disability.
Okay.
Has to be a Surprise resident. They can apply for a home meal program, and the city, through federal funding, will pay for their meal. So they get a free meal delivered to their home. There's other qualifications and things that are in place that you can find on our application. But this is unprecedented time, so we're trying to do what we can to help those folks who are
Super.
homebound.
That's great, Seth.
So-
Super. And I know you have a very effective resource center that you run, but I know you're changing a little bit the way it's applied. Can you talk about that?
Yeah, so our resource center is, thanks to the support of our leadership, mayor, council, we've been able to really grow it the last several years. And we've got it to a point where now we can help a lot of people, but now we can't see them. And it's been frustrating that
Right.
we've got all these resources available. So what we've done is we've had to reduce the hours of walk-ins. So the center remains
Okay.
open. We're asking everyone to call first before they come down, and
Okay.
hopefully we can help get people directed to the right resource at the right time.
Okay.
So currently we have utility assistance available. We have limited eviction prevention assistance. There's been all the utilities, most of the utilities, and the governor yesterday announced that evictions will be put on hold.
Right.
We don't want any family waiting though. So if you need help now, call the resource center.
Okay.
So if you need utility assistance or rental assistance, call our Hope line on Monday morning. That's 623-222-HOPE.
Okay.
It opens up at 8 o'clock in the morning. If you can leave a message, that means the line is open. If you can't leave a message, that means we've already shut it because the demand has been so high.
Yeah.
So, but we do have resources available. We're able to get a little bit extra money because of this pandemic for utility assistance for electric and gas.
Good.
So
Good.
again, even though the utility may not shut you off, don't wait. We encourage people to get help. We're doing pickup and drop off services, so you can't. Not a lot of people are going to be able to enter the resource center, but our staff is there ready to help get you into the right place
Great.
for specific services.
Great.
So we have benefit assistance. If you need help with applying for unemployment insurance, we're seeing a lot of layoffs happen. If you need help applying for food stamps or cash assistance or healthcare access, we have partners who are standing by ready to help people over the phone, mostly at this point,
Okay.
help them get services. So
Good. Good.
when in doubt, if you have any questions, please call the front desk of our resource center, and that's 623-222-1600, or go to our website. And we have, through the partnership with the City of Peoria, we have a community resource guide that's very comprehensive. And so if anyone is looking for a service that they may not know about, we'd love to have them look at it. We have that on our website in English and in Spanish.
Okay.
But there's a lot of
They
information.
go to your department first, and then the resource center's under your department.
Yes, sir.
So Human
Yep.
Service, Community Vitality, click on that first,
Yes,
and then the resource center.
that's
Great.
right. There'll be pictures of both guides. But when in doubt, call us at the resource center. We'll do what we can to get you
Okay.
in touch with the right resource.
That's great, Seth. I hope this show helped to answer your questions and calm your concerns. For more information, please check out our city's COVID-19 webpage at www.surpriseaz.gov/COVID-19. Thanks for watching the show today. We're a strong and resilient community, and we'll get through this together.